All right, hello everyone, and welcome to the Mind-Body Connection, How Metabolic Health Contributes to Brain Health webinar with Dr. Taryn James. This webinar is presented by the Wisconsin Institute for Healthy Aging, or WIHA, with funding from the 2023 through 2028 CDC grant, Building Our Largest Dementia Infrastructure, or BOLD. My name is Erin Eggert, Deputy Director here at WIHA, and I'm excited to welcome everyone to today's webinar. Just a few housekeeping pieces. All participants will be muted and have their cameras off during this presentation. This webinar will be recorded and an email will be sent out to all registered participants after the webinar. Please use the chat box to submit any questions. We will have time for questions and answers at the end of Dr. James's presentation. Before we get started, I'll just give a brief overview of WIHA. WIHA is an organization whose mission is to improve the health and well-being of all people as they age. We encourage you to learn more about our programs and initiatives on our website and to sign up for the Age Well newsletter if you're not already. Now I'll introduce our presenter. Dr. James is a scientist with diverse training in biology, pharmacology, toxicology, and molecular biology methodologies involved in drug development. Dr. James currently works as a scientist at the Wisconsin Alzheimer's Disease Research Center on analyzing hormone therapies in memory decline and as a principal investigator on diversity for the AHEAD study, a multi-center clinical trial testing a medication to prevent or delay Alzheimer's disease. Dr. James, thank you for being here today, and I'll turn it over to you.
Thank you, Erin, for that introduction. I'm happy to be invited today to speak to you about the mind-body connection. And we'll get started in a minute as I get my slides up. Can you see my screen at all?
We can. Perfect.
All right. Thank you, everyone, for attending today's webinar. And I will get started. So today we will talk about the mind-body connection, how metabolic health contributes to brain health. I have on this slide my email. Feel free to email me if you also have questions remaining after this webinar. So first, I will go through my introduction. I will first talk about cognition and dementia. I will talk about Alzheimer's disease, which is the #1 cause of dementia. And I will talk about dementia risk factors. That includes metabolic health. I will give you an idea of what it means to have metabolic syndrome, talk about the diseases involved in that and how they contribute to dementia. I will talk about having central adiposity or belly fat and how that contributes. And then we will talk about methods of risk reduction, such as exercise. So to begin, I want to talk about the brain, and there are 3 major functions of the brain. I was involved in an article with the Wisconsin Institute of Healthy Aging that was titled The 3 M's. And for the 3 M's, it's mood, movement, and memory. So that's 3 major functions of the brain. So the brain is part of the central nervous system along with the spinal cord. It helps control bodily function. It signals through the spinal cord to control movement. And another major function of the brain is memory. So when we talk about cognition, that we will get into next, memory is involved in cognition. So memory include learning skills like driving, learning language, memorizing, for example, a dinner menu when you go to the grocery store and you're trying to recall your items. And then the brain also contributes to your mood, for example, and these three functions kind of help work together. For example, if you're depressed and you start moving your body through exercise, that can help to increase blood flow to the brain and help improve your mood. So that's one way to think about it. And then when we start seeing issues with the brain, you can see issues with your mood, your movement, or with your memory. And I'll talk about that. All right, so first I want to talk about what is cognition and dementia. So cognition includes memory, language, problem solving, thinking. And dementia is an umbrella term that can happen if you have issues with cognition. So if you have difficulty with these list of items, it can lead to dementia. And there are different types of dementia that you see here in the slide. The number one cause of dementia is Alzheimer's disease. So I wanted to give a little bit of background on Alzheimer's disease. So it's an irreversible progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out daily tasks. So when we say dementia, when someone has dementia, they have issues independently carrying out daily functions. And so what we have found is that in the brain of people that have Alzheimer's, they have some abnormalities going on. So on the left-hand side, you have an Alzheimer's brain, and what you can see is that it's characterized by having plaque buildup between your brain cells. So these purple these purple items are brain cells that have projections, right? They have to communicate with each other. But when you have buildup of amyloid plaques, it prevents them from communicating. Additionally, in people with Alzheimer's, you also see what you call tangles occurring inside the brain cells. And all of this affects how well the brain functions when you compare it to a normal brain. So what happens is if the brain cells are not carrying out the function how they should, this can lead to cell death, and then this can lead to brain shrinkage as well. I'm having a little trouble advancing my slide. Okay, here we go. So in this slide, I wanted to talk about Alzheimer's disease progression to give an idea of what it looks like. So Alzheimer's disease developed over many years. It can take 20 years before someone might start seeing symptoms. So before you start seeing symptoms, it's called preclinical Alzheimer's disease. So you might be having those changes occurring in your brain, but it's not yet affecting you. So when you have mild cognitive impairment due to dementia, which is the yellow area here, this is when you start seeing symptoms. So if you go into a clinic with symptoms, you could potentially be diagnosed with mild cognitive impairment due to dementia. And this is where people start having issues with everyday activities. So in the early stage of Alzheimer's, the person is able to live independently. They may have issues remembering words, location, familiar things, which can lead to social withdrawal. So as the disease progresses, you will then have mild dementia due to AD. This is a mild stage of the disease. Symptoms starts to interfere with your everyday activities, and these stages can occur over many, many years. So when you start having moderate dementia, you have symptoms interfering with more daily activities. In the middle stage, damage in the brain accumulates and prevent tasks like driving. Individuals need more support, This leads to less effective social interactions, and frustration and anger can develop in that person as their memory decline. In the late stage, when someone has severe AD, they cannot function or communicate. The progressive brain decline results in loss of body movements, and the individual will need help doing daily tasks like bathing and eating. So I wanted to give a picture of normal aging versus Alzheimer's disease. And so what you see in this table is that on the left side, we have examples of what normal aging would be compared to the right side where we have examples of Alzheimer's. So occasionally making the wrong decision or occasionally making the wrong decision is normal aging. But if you're frequently showing poor judgment and decision making, then that could be signs of Alzheimer's. If you're forgetting to pay a bill, that could be normal aging. But if you're not able to manage your money or your household finances, that's a sign of Alzheimer's. If you don't remember what day it is, but you remember later, but you don't know the day or the year, then that's the other side of that is Alzheimer's. So in normal aging, you'll have trouble remembering the correct word to use. But with Alzheimer's, you may not be able to hold a conversation intelligently. Losing your car keys is another example of normal aging, or other things here and there. But if you're losing things and not being able to find them, then that could be a sign of Alzheimer's. So what causes dementia or Alzheimer's, or what we're talking about here, Alzheimer's disease? So there are non-modifiable causes of dementia, and this is your age. Your age is one of the biggest risk factors for dementia. It increases in every decade. Dementia or Alzheimer's is normally looked at as having issues after the age of 65. But if someone is developing Alzheimer's before that, it's considered early onset. If you have family members that have Alzheimer's, this increases your risk. There can be a genetic component to the disease, and and also family history. For especially in some families that have early onset, there are certain genes that are affected that can lead to development of dementia symptoms. However, there are modifiable risk factors for dementia, and this image is from a 2020 report from the Lancet, and it shows here 12 modifiable risk factors for dementia. And so what we have here is physical inactivity. So if you're not exercising enough, if you're a smoker, that increases your risk. If you're consuming too much alcohol, that also increases your risk. Air pollution, having head injuries. If you're not having enough frequent social contact, that increases your risk. If you have less education. So what we're going to focus on, and I'm sorry, also if you have hearing impairment, what we're going to focus on today is obesity, hypertension, and diabetes. These are some diseases that contribute to dementia and Alzheimer's disease. And then there's another risk factor that I didn't mention listed on here is depression, but we won't talk about that one today. So first, excuse me. To talk about metabolic health, I wanted to first give a definition of metabolism. So metabolism is the chemical reactions in the body cells that change food into energy. So the ability of the body to regulate the use of nutrients and bodily functions is called metabolic health. The metabolic syndrome is having three or more diseases such as high blood pressure, insulin resistant, diabetes, or cholesterol problem is considered having metabolic syndrome. And this can result from the body not being able to to use nutrients correctly. So one of the nutrients we're going to focus on today is the metabolism of lipids. So lipids are fats, waxy type substances, oils, hormones, triglycerides, and they are components of cell membranes. They function as energy storage molecules, chemical messengers. They help with vitamin absorption and making hormones in your body. Cholesterol is a waxy type of lipid. And lipids are water insoluble. Therefore, to travel through the body, to travel through your blood, which is more of a water-based solution, they have to bind to a protein. And so when they bind to a protein, they become a lipoprotein. Examples are high density lipoprotein and low density lipoprotein. And your cholesterol can be made by your liver, or it can come from your food. So on the right-hand side here, I have a chart from the American Heart Association. What I wanted to point out is that, when you go to the doctor and they measure your cholesterol level, they're looking at your good or bad cholesterol. So the good cholesterol is the high-density lipoprotein. The bad cholesterol is the one, or the LDL, the low-density lipoprotein, is the one that can contribute to plaque buildup in your arteries. When that occurs, this increases your risk for heart disease and stroke. And having heart disease, if you have an increased risk for heart disease and increased risk of stroke, that can increase your risk for dementia. The other nutrient or molecule I wanted to talk about is sugar. So we've all heard about carbohydrates. A lot of us like to omit carbs so that we can lose weight, right? So when we eat carbohydrates, what happens is that they are broken down into what you call simple sugars. Glucose is an example of a simple sugar. So when you have glucose in the blood, it's going to signal the release of insulin from your pancreas. So when you eat a meal and your body breaks it down into glucose, your pancreas then will release insulin to help your body utilize that glucose. And so the goal of that is for the sugar or the glucose to be taken up into your cells to be used for energy, right? But what can occur if there's a dysregulation with sugar, or you're eating too much sugar, anything like that, is that your insulin may not function how it should, or your pancreas are not making the insulin that you need, and then you can develop what you call insulin resistance. And insulin resistance can then lead to prediabetes, and then eventually diabetes. And some diabetics are dependent on insulin in order for their body to process sugar. And again, having too much sugar is also a risk factor for dementia. And we'll talk more about that in a little bit. Another thing I wanted to mention is what you call the microbiome. On this slide, I have a definition from the NIEHS. The definition is the collection of all microbes such as bacteria, fungi, viruses, and their genes that naturally live on our bodies or inside us is called a microbiome. The microbiome is diverse and it's formed in your first years of life. It can be affected by your diet. So what foods you're consuming medications that you're taking, and environmental exposures. The microbiome functions to help protect, it helps to protect us from pathogens and also help to improve our immune system. And also it helps us to digest food to produce energy as well. So if you have a disruption in your microbiome, this can affect your health. It can increase your risk for developing metabolic syndrome diseases such as diabetes, and it can also increase your risk of developing neurological diseases. So the gut microbiome is the microbes that live in your intestine. Gut microbiome is also related to it affects your heart and brain health. Some gut micro, some gut, I'm sorry, some gut bacteria. So I'll focus on bacteria when I talk about the gut microbiome. Some gut bacteria can help to reduce cholesterol. And some gut microbes can also produce chemicals that can contribute to heart disease. For example, when you eat red meat, certain bacteria in your gut can produce a chemical from that red meat, and this chemical increase your risk of having blocked arteries, which can increase your risk for heart attack and stroke. The gut is also connected to the brain by millions of nerve cells. Some studies have shown, for example, probiotics can improve depression. So the gut can negatively, the gut microbiome can negatively or positively affect your brain health. So now I want to go back to talking about the modifiable risk factors for dementia. So how do you reduce your risk of developing these type of diseases such as hypertension, diabetes, and obesity? And in that way, how that will help you reduce your risk for developing dementia as well. So when we talk about metabolic syndrome diseases, when we're looking at hypertension, we're looking at a blood pressure over 130. A blood pressure over 130. We're looking at a blood pressure over 130, your fasting sugar over 100 milligram per deciliter, increased triglycerides in your blood over 150 milligram per deciliter, and increased waist size. So in a man, an increased waist of greater than 40 inches, and in women, an increased waist of greater than 35 inches. What happens is all these things that I just read out to you are all part of having insulin resistance. And insulin resistance is an early stage of type 2 diabetes that increase your risk for chronic diseases. So we talked about insulin earlier with the metabolism of carbohydrates, but it's a hormone that's also involved in the regulation of fat and protein as well. So not just carbohydrates. And I gave a brief definition of resistance earlier, but here I'll say it again. It occurs when your body can no longer use the insulin efficiently. And so when you have insulin resistant, it signals a state of metabolic dysregulation where you have an excess of nutrients, for example, sugar in the blood. So when this occurs, when you have these kind of issues going on, you can develop what's called a metabolic syndrome. And the metabolic syndrome is having 3 or more of the diseases shown here, where you can have high blood pressure, polycystic ovarian syndrome. You can have trouble regulating your lipids, and type 2 diabetes, non-alcoholic fatty liver disease, where your liver starts storing fat because lipids are not being regulated properly. So your liver is starting to take up the fat from your blood. And also, metabolic syndrome increases risk for cancer. For example, diabetics have increased risk for colon cancer. And cancer cells loves sugar because sugar helps them to keep growing. So as a quick summary, having metabolic syndrome is a state where your body have an excess of sugar and fats. And what we have seen is that when you have a lot of belly fat, this can increase your risk for having these metabolic syndrome diseases. So belly fat is also called visceral fat. Belly fat can be a source of hormones, especially in women after menopause, and it can function like an organ. So what happens is when you think about obesity, central obesity or central adiposity or having belly fat becomes really important. And so we like to look at this as how your body is shaped. So if you have an apple shape, which is shown here in red, your health risk is higher than if you're pear shaped or if you're avocado shaped. So the pear shaped person has the lowest metabolic risk. And so for some studies, we can look at how your belly fat is related to your metabolic health, because it can be used as a marker of obesity. Women tend to have more lower body fat and men tend to have more upper body fat. And so sometimes men can tend to have like a larger waist to hip ratio than women. And an increased waist increases your risk for a decline in cognitive performance. So many studies have shown that. So I want to now switch gears to talk about how the metabolic health connects to your brain health. Why does it increase your risk? So this is a very technical slide, but what it's showing is that on the left side, you have your metabolic health, right? And for example, here it's showing what happens when you have insulin resistant, that it can be caused by obesity. And it can lead to prediabetes and then eventually type 2 diabetes. And then on the right side, we have your brain, right? So how do you get from having a metabolic disease here that leads to what we call neurocognitive decline, which can lead to dementia? So how does that affect your brain functions? So it happens at what we call the molecular, cellular, the organ, and the systemic level. So when you have these kind of disease states, it can create more inflammation in your body. Inflammation is something that's not good for you. At the cellular level, right, having this increase, having these increased markers in your body could affect how well the brain cells perform. So it can lead to the cells dying off, as I talked about earlier. Just like how you have those plaques in your brain for Alzheimer's, where your brains are not able to communicate well with each other, and they lead to cell death. Having certain markers that can travel in your blood into your brain can affect how well your brain cells can function. And then when you have increased sugar in your blood, this can directly damage your blood vessels. If you think about it, if you mix sugar into water, it's thicker. This can affect how well your blood flows. And so if it's leading to, if it's affecting how your blood flows, it can affect how blood gets to your brain. This can occur, we can see this in people who have what you call vascular dementia, where their blood cells are affected and contributes to to a decline in their cognitive function. And then when you have dysregulation of glucose, it affects, how well your body and your brain can use sugar. So not only can you have the resistance occurring at the body level, but it can also occur at the brain level, where your brain is not using sugar effectively. And I summarize it here, talking about why diabetes and the brain is linked, because it can lead to damaged blood vessels, and similar factors contribute to both diabetes and Alzheimer's disease. And I pretty much covered some of these things already, so I'll move on to the next slide. I wanted to tie in the belly fat. Increased belly fat reduces how well your brain can function, because it increases your risk for markers that can lead to a damage to your brain cells. I also wanted to mention that other hormones are implicated, such as estrogen. Estrogen is involved in regulation of metabolism. It's also involved in how well your brain functions, how well your brain cells function. So after menopause, women have increased risk of developing dementia due to the loss of estrogen. And so clinical trials have been looking at, if you give estrogen as a replacement therapy, how does this affect does this help improve cognition? And then I wanted to also point out that African American individuals have higher prevalence of dementia, which can be related to having higher prevalence of these metabolic syndrome diseases, such as diabetes and high blood pressure. And so when we talk about how to reduce our risk for dementia, I think some of you might have seen this chart before. There's lots of things you can do by being more physically active, following a healthy diet, and challenging your brain. There's a webinar that was done in November by Carol Van Hoof, also from the ADRC, where she went through all of these factors and how you can reduce your risk. So you can eat certain foods that can reduce inflammation. You can exercise regularly. You can stimulate your brain. And also, one of the major things you can do to reduce your risk is to increase your sleep. So people who sleep less than 6 hours a day have higher risk of having neurocognitive decline. So reducing your stress, socializing, these are things that we can easily change to help improve our brain health. So I have here some resources that I use for the presentation. I also wanted to mention that this is a slide about our Alzheimer's Disease Research Center. If you want to hear more information about the UW Alzheimer's Disease Research Center, you can go to the website adrc.wisc.edu, and you can also look at these tabs to see what we're doing at the ADRC and how you can get involved in studies, etc. So I will take any questions you may have.
Wonderful. Thank you so much, Dr. James. And while we're waiting for questions, which you can enter into the chat, I'm also going to share a link for today's evaluation. If you could take a couple of seconds just to complete that short evaluation out, then you'll be entered to win an Age Well t-shirt from WEHA as well. The evaluation just needs to be completed today. So I'll enter that link in the chat. If you could just click on that link. And then if you have any questions, please enter those in the chat as well. For some reason, it's not letting me enter into the chat. Ooh. All right, that link is in the chat, and we do have the first question for Dr. James. Is dementia hereditary?
It can be hereditary if you have a gene that increase your risk. It doesn't always mean that you will get it, but if you have a primary relative, meaning one of your parents that had the disease, it increases your risk to develop the disease. And there are certain, so we have genes, right? But we also have variants in genes. So certain gene variants can also increase your risk. But yes, if it can be hereditary. Well, I'm sorry, I'm specifically talking about Alzheimer's. I'm talking about it in the context of Alzheimer's disease, which is the #1 cause of dementia.
Great. And the next question is, how much and what type of exercise is recommended for reducing occurrence or symptoms of dementia?
Okay, so this is a good question. I think at least 30 minutes of moderate exercise. I think walking, as long as you're doing like moderately, that should be enough to reduce your symptoms about 50%. Some studies have shown that if you're exercising moderately, you can reduce your risk by 50%. But one thing I should say is that we can do everything to reduce our risk and still get dementia, right? It doesn't mean that you shouldn't do all these things, because what happens is when you're following a healthy lifestyle, it's reducing your risk for stroke, high blood pressure. And what's good for your heart is good for your body. But, because of there's different causes of dementia, you can do everything right and still get it. So I just wanted to point that out.
Thank you. And there's a question on, are brain puzzles helpful in reducing the risk of dementia?
Let me go back to previous slides. It's good to do puzzles, good to do activities to stimulate your brain. Let me see what it says here. So challenging your mind, like it says, like building furniture, playing games, like bridge. But the idea is that when you're challenging your brain, you're using your brain cells, right? You're making like more cognitive connections, and that helps with your brain activity. And that's why social interaction is also important, because you're talking to people, you're having, connections that can stimulate your brain. What you don't want to do is, have interactions with people that increase your stress activity, because that's not good for your brain.
And of the methods for risk reduction there, are those all weighted the same, or are there some that might be more important than others?
That's a good question, and that's not, I don't think that's something I don't think we talk about it in that way. Maybe we can consider how to get around that. I mean, like how to think about that in the future. But what I would say is like stuff like if you're not smoking, that's something good. If you're not consuming a lot of alcohol, because alcohol is a toxin, that's also something good. And you can have alcohol-induced dementia. So when you're having these healthy life choices, it's gonna greatly reduce your risk, like moving your body. Like I said, like when you're doing stuff like that, it's what's good for your body is gonna be helpful for your brain. Like stuff like diet. I think these will more directly
Mhm.
increase your risk because we talked about that microbiome. So you can follow a healthy diet that's good for your body. Certain medications you might take might affect your microbiome, and then you might need to try to improve that with like probiotics. So I would say it's possible there's other things. I'm sorry, I would say back to the question. I would say yes, some things might have more weight than others, but doing all of these things would greatly reduce your risk.
And what about when we talk specifically about the metabolic health factors? Like you mentioned blood sugar, cholesterol, blood pressure, and weight. Do you think those have different weights to them in terms of importance of impacting dementia risks as well, or are those kind of all on the same field?
Mm, I would say, well, I talked about them together as the metabolic syndrome. So they, it's because there could be what you call one increase the risk for the other, right? So if you're obese, it can increase your risk to develop insulin resistance, and then it increase your risk to develop, if it's not reversed or if you don't reduce your obesity, then because you can be obese and healthy, right? But at some point, if it's not addressed, then you can start getting in when you're not healthy, where now you start having, now it's affecting your metabolic health. You start getting heart disease, you might have insulin resistance. I- I'm hope I'm hoping I'm answering your question.
Yeah,
You might need to repeat it, but so they're all kind of connected, like one is affecting the other. So you can reduce your risk for, let's say you're obese, right? And you're metabolically healthy, and you want to reduce the chances of you developing insulin resistance. One of the main things you can do is try to lose weight. Like being more physically active reduces your risk. And then if you're following a healthy diet, for example, consume, if you want to have, okay, if you want, instead of orange juice, maybe eat the orange, right? So you can make certain lifestyle choices, is what I'm trying to say, to reduce your risk of developing something further by just reducing one aspect of it.
right. So it's important to address all of those. There's a question on, as we enter the later years, I'm assuming our awareness to our recall and loss of words is starting to pop up. At what point should we say something or be concerned with a loved one degrading? And can we detect Alzheimer's through testing, or is it still after death?
Okay, this is a great question. So so what we talked about is that we have normal aging and we have abnormal aging. I was trying to see if I can go back to that slide. So what you want to think about is if you're having issues that's starting to affect your daily activity, then that's when you want to seek help, like going to a memory clinic. And if it's bad, one of your family members might also notice that you're having issues. I'm trying to find a slide as an example. So think about this slide. So if it start getting bad where it's affecting your life, maybe you'll notice yourself or one of your family members. And so that's when you get help. Can we detect Alzheimer's through testing, or is it still after that? We now have blood tests that can help tell us if you're probably having buildup in your brain. Right now, they're used for clinical trials. They're not, we use them for research right now. Hopefully in the future, that's something that will be available. So, but if you go to a memory clinic, they can give you a series of neurocognitive tests that can suggest that, like when we were talking about the early diagnosis, when you work with when you go to the memory clinic, they can give you tests that will help us determine what's going on in your brain.
Right, and you mentioned that there are tests to detect buildup in the brain. Are there also tests to help detect, like if the Alzheimer's is genetic, or hereditary?
Yeah, you can test if someone has a Alzheimer's, if they have the gene that predisposes them to Alzheimer's, if they do some of those testing like 23andMe, etc.
Okay,
Um, I see someone say, should a neurologist be a doctor we consider for our annual visits? I'm not sure about that, but I think primary care physicians are now asking these kind of questions that could, that if you're having issues, they will recommend you. They will give you a referral to a neurologist. And also in clinical trials, they're developing tools. A report just came out about a cognitive tool that's being developed to be used in a primary care setting where it does address recall and other factors of cognition, where if your doctor notices that you have an issue, then it will help you to get to where you need to go, to get to a specialist or to get help. So that's something that's in the works.
great. Well, we have a few minutes left. If anyone has any additional questions, please enter those in the chat. And Dr. James, I just have two remaining questions for you. So one is, what is the biggest takeaway that you would tell people from today? Or what is the top thing that you would recommend people prioritize to help prevent or reduce their risk for dementia?
Okay, I like this question. Normally when people ask, my first response is to improve your sleep, because that's something that you can easily do. Well, unless you're having issues that needs to be addressed by your primary physician, we can all choose to go to sleep earlier. And when you're sleeping, your brain, that helps your brain to clear toxins or these proteins that can lead to the plaque development. And so when I was talking about the blood test, what the blood tests do is that depending on the level of amyloid, which is a biomarker for Alzheimer's that we see in the blood, it suggests whether it's building up in your brain or not. And so sleeping is one thing that you can do. But I think what we put in our body, what we put on our body, our exposures, I'm talking about smoking, alcohol, air pollution, that's something that increase your risk. And if you ever want me to talk about that, please invite me back to talk about that. So just following that last slide, what we talked about, I think the diet, the sleep, and the exercise is something that we can all try to incorporate to reduce our risk, not only to have metabolic health, but to have heart health. Because all these all these contribute to your metabolic health. So just, you know, think about it, what you put in your body breaks it down, it goes into your blood. It can probably affect your brain as well. So
Great. And my last question, Dr. James, is what is your favorite part of your job or what you do?
my favorite part of my job, I don't think I've thought about that in much detail, but I have a lot of experience going out in the community and giving presentations similar to this, talking about brain health, like giving back, going to community events and talking about brain health or clinical trials, just explain what it means to why we do clinical trials, and also explaining to people how a medicine might work or what we're trying to do in research to develop medicine. So I would say going out and talking to the community and feeling like I'm making a difference that way.
Great. Wonderful. Well, thank you everyone for attending today's presentation. Next up for our Age Well series, we will be talking about how to make a will in August. And in October, we'll be doing a nutrition topic. So stay tuned for more information on those topics. Just want to thank everyone again for joining the Wisconsin Institute for Healthy Aging, or WIHA, for the Mind-Body Connection, How Metabolic Health Contributes to Brain Health webinar with Dr. Taryn James. As a reminder, this webinar was presented by WIHA with funding from the 2023 through 2028 CDC grant, Building Our Largest Dementia Infrastructure, or BOLD. We thank Dr. James for her time and knowledge during today's presentation. We will be sending out an email with a copy of today's slides, as well as a recording from today to those who registered for the webinar. Thank you, everyone, and have a great day.
Thank you for having me.